It's amazing the number of people who suffer from dry eyes, and one of the biggest problems with dry eyes is people thinking that dry eyes is not a disease. Dry eyes is not only a disease, but it's an incredibly common disease. It's almost epidemic among mature Americans. The longer we live, the more we suffer from it, and we live in a very warm climate, and as a result, people already, the tear film is thin just from evaporation because it's hot. There are multiple different layers to the tear film. There's a mucus layer at the very base, there's a watery layer that's what we think of as tears, and there's an oily layer on the surface. Research increasingly shows us that the major problem is the oily layer. It's like an oil slick on the surface of the tears that keeps them from evaporating. And if that oil isn't produced or isn't produced enough, no matter how much tears you produce, you can have your eyes running all day long and you'll still be uncomfortable. Often people don't know they have dry eyes. They just think their vision's poor, or the vision's not as good as it used to be, or their eyes hurt, or they have allergies, or their eyes are red. And all these are just dry eyes. The oil layer is produced by glands in the eyelid called the meibomian glands. The meibomian gland dysfunction, you see a lot of work about it online because we talk about it a lot in ophthalmology. It can be caused by rosacea. The rosacea, you've probably seen it on the cheeks. A lot of people have it, the malar flush it's called. But the most common place to have rosacea is on the eyelids. Anyone who has Irish heritage, Scottish heritage, Irish or Scottish heritage you don't know about. Mariah Carey famously suffered from rosacea. Bill Clinton suffered from rosacea. A lot of famous people, accomplished people, were miserable from dry eyes because the rosacea wasn't treated. If you have just very mild dry eyes, we can often treat it with just artificial tears, with just drops. If it's more severe, we might use something called punctal occlusion or punctal plugs to keep the tears in your eyes longer so they don't evaporate so fast. There are a lot of medications that treat the rosacea, medications that can even make you produce more tears. If everything else fails, there's a treatment called intense pulse light therapy. It's sort of the atomic bomb for dry eyes. It works great. It actually can dissolve the abnormal blood vessels that cause rosacea, and it's highly, highly effective, and it's sort of the last thing after we've tried everything else.